New at 11, a group of Virginia doctors want state lawmakers to act on a bill that pushes for lower prescription drug prices.
Advocates say far too many of their patients are forced to ration pills or go without the medicine they need. Angelique Arentalk found out what the bill would do if passed.
Depending who you ask, the price for a prescription ranges.
Most of them are fairly inexpensive, but there are some that are pretty expensive.
Even with insurance, it's probably $100 to $200 a month.
As for those prescribing the medicine, some are raising concerns about troubling trends they're noticing.
Too often, I hear my patients tell me the medications work and are effective, but they can't afford them.
Well, my patients are being forced to skip medications and inherently put their lives at risk. Pharmaceutical corporations continue to rake in massive profits.
These doctors list patients with asthma, diabetes, heart problems, and HIV among some of the groups they worry about.
I also have several patients report that they struggle with side effects of generic medicines that they need for their mental health. These stories are all too common, and the statistics are sobering.
That's why there's a push to move Senate Bill 957 along in the Virginia General Assembly. If ultimately given the green light, the legislation would form a prescription drug affordability board. The 5-member expert panel would cap prices on some medications, demand companies to lower costs, and call for transparency.
The stakes are high for these patients and their families.
Angelique Arentalk, 13 News Now.
Currently, the bill's patrons are all Democrats, but advocates are calling for bipartisan support on the measure.
They expect Virginia state senators to decide on the legislation's fate this Friday.